Hello everyone, myself Dr. Subash Singh. I am leader in Department of Periodontics and Preventive Dentistry, Babu Mrajdas College of Dental Sciences, BBDU. Today I'll be delivering lecture on space maintainers. Space maintainers. As the name itself suggests, these are the appliances which maintain the space after the exfoliation or premature exfoliation of the deciduous or primary teeth. So these are the appliances which maintains that space which is uh, present after the early exfoliation of the primary tooth. So it can be defined as a fixed or removable appliance placed to maintain space created by the premature loss of a tooth or teeth. It can be single tooth or more than one tooth also. Now, what is the best space maintainer? The best space maintainer is a primary tooth itself. So, as a periodontist, it is our duty to maintain the primary tooth or to restore the primary tooth as long as possible, maybe for 1 month also. So, because the tooth itself is a only best space maintainer, nothing can mimic the primary tooth itself. Now, why do we need a space maintainer? The space of prematurely lost teeth usually change in the 6 months period. Sometimes a decrease in space may occur within days or weeks, which may cause loss of arch length, resulting in crowding of the permanent dentition. And it can also lead for the impaction of permanent teeth. Aesthetic difficulties will be seen, malocclusion and other problems can be seen. So these are the particular reasons why we need the space maintainer. Now, as we can see in this X-ray radiograph that the arrow marked with red. So there was a premature loss of a deciduous tooth. So because of that loss, the anterior tooth has moved distally and the posterior tooth has inclined mesially. So because of this nature of the tooth, adjacent tooth, there is a loss of space, as we can see with the help of a red arrow where it is marked. So that is the reason we need space maintainer. Now, what are the indications of a space maintainer or when to give the space maintainers? The first one being, if the space shows signs of closing after exfoliation, if the space shows signs of closing in the X-ray or radiograph, then if the use of space maintainer will make the future orthodontic correction less complicated. As we can uh, decide also, as we can see ki, when space maintenance are given, then the future crowding is reduced. So what it is done is it that future orthodontic, or you can say the complex orthodontic correction is reduced. If the need for treatment of malocclusion at a later date is not indicated, sometimes because of after giving the space maintainer, future treatment of malocclusion is also uh, can also be reduced. When the space should be maintained for 2 years or more, sometimes the space is maintained for further treatment, for some future treatment. So to maintain that space, we also give space maintainers. That is generally used in cases of when there is loss of permanent teeth actually. Now to avoid supra-eruption of opposing tooth, space maintainers or is can be given to prevent the supra-eruption of the opposing tooth. The best space maintainer generally for this purpose is acrylic partial denture with a tooth in that. Now to improve the masticated system and restore dental health. As we all know, when we give a space maintainer with the function, then it obviously will improve the masticated system and restore dental health. Now, what are the contraindications of a space maintainer? If the radiograph shows that the subcutaneous tooth will erupt soon, if the radiograph shows 1/3 of the root is already calcified, when the space left is greater than the needed for the permanent as indicated from radiograph. When we see that already the space is too much after exfoliation also, or after the removal of any deciduous tool because of caries, if we see or we check in the radiograph that the space already is quite more than the required than the required for the permanent teeth to erupt, then in that case also there is no indication or there is contraindication of a space maintenance. Now, if the space shows no signs of closing, then also we have to not give any kind of space maintainer. And when the succedaneous tooth is absent, it means when there is no permanent tooth, obviously then there is no need of giving any space maintainer, because in that case treatment of choice is will be decided afterwards or when all the permanent teeth erupts. Now, what are the factors which influence planning for space maintainers? There are certain factors which we should consider before planning a space maintainer. The first is time lapse since loss. That means how much time is lapsed since the tooth is lost. It means maybe if it is more than 3 or 4 years, then obviously we can see if the space is not lost, then it is predicted that the space will not be lost more now. So if uh, the space is quite visible, then it means we don't need to give any kind of space maintainer. Now, what is dental age of the patient? See, if a dental age of the patient is considered, if the child is of, for example, 10 years old and the first deciduous molar is exfoliated, then we can predict that now the permanent tooth is about to erupt. So there is no need for space maintainer. Amount of bone covering the unerupted tooth. Now, sequence of eruption of teeth, delayed eruption of permanent teeth. In these are the factors which we should uh, see before planning for a space maintainers. Now, congenital absence of permanent teeth and presence of oral habits also should be considered. Now, classification of space maintainer. The classification of space maintainers can be summarized as follows. It can be functional or non-functional. As the name itself suggests, functional, which provides the functions like chewing, aesthetics, and phonetics. Then other ones are non-functional. Now, according to activity, it can be active or passive. Active means which apply or which exert certain kind of force on the tooth. Passive, it doesn't apply any kind of force. Then according to retention, it can be fixed, semi-fixed, and removable. Now, there are various classifications according to the authors. According to Hitchcock, it can be removable or fixed space maintainer. It can be with bands or without bands, functional or non-functional type, active or passive, and there can be certain combinations of above. According to Raymond C. Thoreau, it can be of removable type, complete arch type. Examples may be lingual arch type and extraoral anchorage. Then it can also be of individual tooth type space maintainers. According to Hendrickson, fixed space maintainers and removal space maintainer. Under fixed, we have class 1 and class 2. Under class 1, we have non-functional. Examples will be bar type, loop type, and in functional type example, Pontic type and lingual arch type. Class 2 can be cantilever types, example band and loop, and distal shoe appliance. Removal space maintainer is acrylic partial denture. Now, the most commonly used space maintainers are band and loop, crown and loop, lingual heart holding device, nines palatal holding device, transpalatal, distal shoe, and removal space maintainers. These are the most common type of space maintainers which are used. Now, the band and loop space maintainer. It is indicated in primary dentition when there is loss of one or two teeth, and it can be unilateral or bilateral. crown and loop space maintainer. It is indicated in primary dentition when there is loss of one or two teeth, which may be unilateral or bilateral, and the abutment teeth is grossly decayed, which needs crown. So, if the abutment tooth is grossly decayed, we give first stainless steel crown or any other crown we give. Then over that we do a banding, and then this appliance is delivered. Lingual arch space maintenance, as the name itself suggests, lingual arch is given in mandibular arch. It is indicated in mandibular arch when there is bilateral loss of one or more teeth and all the incisors are permanent. So this is the main thing, that incisors should be permanent. Nance palatal arch, it is indicated in maxillary arch when there is bilateral loss of one or more teeth and all the incisors are permanent. We can see in the picture also. Transpalatal arch appliance, it is indicated in permanent dentition when there is multiple loss of tooth unilaterally. It is not bilaterally, it is only unilaterally, and then that too when there are more than one or two tooth lost. Now comes the very important appliance, which is distal shoe appliance. This is very important in terms of exam for various final year students. Distal shoe appliance, it is used when second primary molar requires extraction and the first permanent molar has not erupted. So there are two things to remember, that the permanent first molar should not erupt, is not erupted, and because of any reason, the deciduous second molar also is needs extraction. So it is indicated when there is premature loss of deciduous molar before the eruption of the permanent first molar. Now, after making this appliance, it has to be checked in the radiograph that what is the position of the appliance and the length of the vertical arm. You can see that there are two parts of the arm, the horizontal arm and the vertical arm. Then vertical arm should always be 1 mm below the mesial marginal ridge of the unerupted permanent first molar. Later on, when the permanent molar erupts, this appliance is replaced with any other type of space maintainer. Generally, we give again here band and loop space maintainer. Now, removal space maintainers, which can be non-functional type and functional types. The picture here shows the functional type of space maintainer. It is like a acrylic partial denture. Not only mere space, but also the vertical space is maintained. But also the vertical space is maintained. Masticative function is stored in functional type, and aesthetic as well as speech improvement is seen. So this kind of removal partial dentures are very important, or very you can say very useful, because it maintains the function also and the vertical space is also maintained. In this drawing, the mandibular right second primary molar is missing on a 4-year-old child. In our judgment, is this a child in need of space maintainer? Yes, this child is in need of space maintainer. Again, this is a situation where space maintainer is indicated. Second deciduous molar was lost and permanent tooth also has not erupted, so it is the distal shoe appliance here is indicated, as you can see in the picture. In this drawing, the mandibular right first primary molar is missing on a 6-year-old child. So what we should do, or which kind of appliance we can give? We can give a removal appliance or a fixed space maintainer also. Removal means space maintainer. Fixed space maintainer can be band and loop, and the removal space maintainer may be acrylic partial denture. In this drawing, the maxillary, primary, central and lateral incisors are missing in this 4-year-old child. So this child also needs a space maintainer where we can give a removal or a fixed space maintainer again. Like this, all the incisors are missing. So in this case, acrylic partial denture can be given to improve the aesthetics, phonetics. But for a fixed type of appliance, a fixed appliance is indicated, which is this appliance is called as Gropper's appliance. It is a fixed appliance instead of removal acrylic partial denture. It is a fixed appliance. So we don't need too much of compliance from the patient. It is fixed on the patient's mouth. Now, space maintenance in maxillary primary dentition. Missing tooth. If the incisors are missing, suggested treatment is no space maintainer required. No consequence except exception if incisors are lost prior to primary canine eruption. If canine is lost, band and loop space maintenance indicated, and it decreases possibility of midline shift. When the first molar, deciduous molar is lost, band and loop or crown and loop space maintainer is indicated, and it prevents loss of arch dimension. If second deciduous molar is lost, then distal shoe space maintainer is indicated, which guides the first molar into proper position. Space maintainer in mandibular primary dentition. If the mandibular primary canine is lost, band and loop space maintainer is indicated. And if the first molar is lost, again band and loop or crown and loop space maintainer is indicated. If second molar is lost, again distal shoe space maintainer is indicated. So generally, whether it is a maxillary arch or a mandibular arch, the things are same, or the appliances chosen are quite same, except the lingual holding arch, which is given in mandibular arch, and the Nance palatal arch, which is given in the maxillary arch. Thank you.